before I continue.
Hindi ko pa po nakikita.
Baka mamayang nyaw-nyaw tayo ng nyaw-nyaw, wala pala tayong recording.
Okay na po.
Okay na? Okay. All right. So we are now at the end of our mycology lecture, which is about medically important fungi. Hopefully you guys still remember your medically important fungi. Let's start with the dermatophytes. Okay, so we are going to discuss epidermophyton, trichosporum, and mycosporum. Microsporum. Now, the medical term that we use for ringworm is Tinea. Okay? Tinea. Okay? Common names for the following. Let me just ask people in the class if they still remember their common names. Tinea pedis is where? You guys can just type it on the chat. Tinea pedis is on pedis. Come on, guys. Tinea pedis. Maybe you would be asked this question in your exams, diba? Athlete's foot. Very good. Or the foot. Tinea cruris. What about Tinea cruris? Jock itch. In Tagalog, what is it in Tagalog? Yung sakit kanina ni Mark. Yung example ko kanina kay Mark. Ano yung jock itch na yan? Hadhad. Okay? Hadhad. Okay? Alright. Tinea capitis sa ulo. Okay? What about Tinea unguium? Unguium. Tinea unguium is where? It's found on your what? In your nail. Okay? Tinea corporis is the body itself. Okay? Anywhere in the body. Okay? Torso. Okay? Most predominantly in the torso. Okay? So these are your tinea or ringworms. Okay? Athlete's foot, jock itch, scalp ringworm, nail ringworm, and body ringworm. Now, fungi associated with tinea. These are the organisms, Trichophyton species, Microsporum canis, and Epidermophyton flucosum. Okay? Now, let's talk about a fungi associated with the following disorders: black piedra and white piedra. Black piedra is associated with Piedra horte, okay, Trichosporum asahi or asahi, or also known as Trichosporum bageli, is now the causative agent of white piedra. So I think in your exams you will still be asked Trichosporum bageli. Okay, because it has not changed in the Philippines. It has only changed in international exams. Okay, so Trichosporum asahi, or formerly known as Trichosporum bageli, is the causative agent of white piedra. Now, what is the distinct morphological feature of dermatophytes when observed in KOH prep? They have segmented hyphae. So, for example, you got a hair follicle, or a strand of hair with presumptive physical examination of piedra. Okay, you were asked to look at it on KOH prep or on the microscope using KOH prep. You're expecting to see segmented hyphae. Otherwise, baka kuto lang yun. Okay? Alright? Now, causative agent of Tinea versicolor is Malassezia furfur. Okay? Malassezia furfur is another fungus that you would see when you're testing or when you want to experiment with your dandruff. Okay? A lot of dermatologists, they would oftentimes attribute dandruff to a fungal infection caused by Malassezia furfur. Okay? So, microscopic appearance of Malassezia furfur or Tinea versicolor or Malassezia furfur is what? Napakadali nito. It's an Italian dish. North from New York pa to. New York. Oh, sino makakaalala? Yan ang mga clues ko. Microscopic appearance of the organism that causes Tinea versicolor is what? Spaghetti. Kulang, di ba, Sir Marco?
Sorry. Nagagalit agad.
Nagagalit ka agad eh.
Sorry.
Nag-react si Sir Marco. Kulang. Ako din, eh. Yun din ang una ko sasabihin, eh. Kulang, di ba? So everybody please remember your spaghetti and meatballs because in your exams, okay? They asked this in the Philippine board exams for one of my friends who actually remembered this question because he said, "Lagi nating pinag-uusapan yung bakla, yung spaghetti and meatballs na yan. Bakit nung exam ko nakalimutan ko?" Sabi niya sa akin, talaga bakla na. Bakla, anong sagot doon? Naalala ko, yun yung last question sa microbiology test ko. Malassezia furfur. What is the appearance? Yun lang yung tanong. So, board exam niya sa Philippines. Sa Pinas. Spaghetti and meatballs lang pala. Nakalimutan niya. Now, it has, Malassezia furfur is something that is of note, something that is noteworthy of Malassezia furfur is its color in fluorescence microscopy when exposed to wood's lamp. Okay, this has the characteristic copper color lesions. Okay? Copper-colored lesions. All right. So we discussed everything about dermatophytes, the skin-related or hair-related or derma-related fungi. We're going to move on with dimorphic, medically important fungi. Examples of dimorphic dimorphic fungi, of medical importance. Babasahin ko na lang siya, guys, para hindi kayo maalala. But don't forget the 6 important ones. Alam ko baka mahirapan, makalimutan nyo na kung paano ang preparation, ang pagbasa niya eh. So, huwag kayo mag-alala. Nandito si Sir Manuel sa kaartehan niya. Okay? So, Sporothrix schenki, Blastomyces dermatitidis, Histoplasma capsulatum, Coccidioides imitis, Paracoccidioides brasiliensis, and Penicillium marnefi. Okay? So those are the organisms that we're going to talk about when it comes to dimorphic medically important fungi. Okay? Pakibasa nga yung pang 5. Try lang natin. kasi last year yan din yung ko. Yan, yung pang 5. Pakibasa nga Eliza. Last year si Adrian yung pinagbasa ko, Sir Marco. Si Eliza this year.
Paracoccidioides brasiliensis.
Diba, Sir Marco? Laging merong variation lagi ng pronunciation. But don't worry, Eliza, you might have pronounced it wrong, but hopefully in your exams, you select Paracoccidioides brasiliensis in one of the questions that is being asked of you or that is being tested of you. Don't worry, it's Paracoccidioides. Okay? Brasiliensis. Alright, now, let's talk about the phase of a dimorphic fungi. What phases would you see the dimorphic fungi in? At 37 degrees Celsius, it's at the yeast phase. At 25 to 30 degrees Celsius or at room temperature, it's in the mold phase. Okay? Now, sir, paano ko madaling maalala? Isipin mo lang yung tinapay na kinakain ni Segi ngayon. Imaginein mo na iwan ni... hindi ba yung tinapay? Alright, so imaginein natin tinapay. Kunyari, tinapay yung kinakain ni Segi ngayon. Okay? So, yung tinapay inaamag, di ba? So, may yeast na yun eh. Niluto na yung yeast eh. Kasi inactivate na yun during the breaking process. Wag nyo akong charutin, okay? Food microbiology yon. Okay? So, for example, iniwan ni Segi yan for like, I don't know, past its expiry date, like 2 days. Tapos medyo basa-basa pa yung wrapper. Diba? So, may humidity na, tapos room temperature pa. Siyempre, aamagin. Okay? Yun lang yung parang maalala ninyo. In the body, you would see a lot of yeast cells. Okay? So, for example, nakita nyo kanina sa blood smear. Diba? Meron tayong WBC na may Histoplasma capsulatum kanina. Diba? So, yeast cells yung nakikita natin. But on the outside, you'd be able to grow certain microorganisms or particularly fungi at 25 degrees Celsius. At 25 to 30 degrees Celsius at room temperature, and they would be expected to be you would expect to see it in its mold phase. Okay, so please don't forget, if we were talking about mold, it's going to be seen at 25 to 30 degrees Celsius. Okay, clear? Tandaan nyo lang yung tinapay na na-expire. Amag pag mold. Okay, huwag kalimutan. Pag mold ang pinag-usapan, amag. Now, let's talk about the causative agent of rose gardener's disease. I think this is also another one of those questions that was being asked, that was asked in the board exams. Who here still remembers rose gardener's disease? Please, anybody? Anybody there? Hello? Hello? Walang makakasagot. What about if I try to call somebody? Let's try calling somebody. What about si anak number one? Junakis. Nandiyan ka pala, nandiyan ka naman pala, Junakis. Nasaan na ang aking anak na smart na at pretty pa? Mana sa akin. Valiant. Wala. Patay. Tsaka bakit nakatakip, naka ano sila ngayon, sir? Di ba akala ko may attendance, may kasama sa attendance nila yan? Bakit wala silang webcam ngayon? Di ba kasama sa attendance nila yan? Sir Marco. Sporothrix. Somebody said Sporothrix. Okay, very good. Glenn Elian said Sporothrix. Okay, it's actually Sporothrix schenkii. Thank you so much. The microscopic appearance of Sporothrix schenkii is that in its yeast phase, you'll see it in a cigar shape. Okay? And it's transmitted to humans by thorn or prick or exposure to peat moss. Okay? Peat moss. So natusok ka or you got exposed or you inhaled it. You have several cuts in your hand and you got pricked by the thorns or you were exposed yourself to peat moss. Moss is basically yung lumot. Okay? Yung mamasa-masa na lumot. Tumutubo sa mga sa pader. So peat moss. Okay? So if you got exposed to that one with open cuts in your hand or any part of your skin or your body, you might get Sporothrix schenkii. Okay? Now, let's talk about the histological features of patients with sporotrichosis. They have what you call asteroid bodies on tissues affected. Okay? Histological sections will show asteroid bodies. Again, this is a question that was submitted to me by one of my students because asteroid body in microbiology, of course, still in microbiology. I think I'm not sure if it was in the Philippine board exams. Asteroid bodies is pathognomonic for which asteroid bodies in histological tissue sections of affected tissue is pathognomonic for which infection. So they gave a lot of choices. But the correct answer is supposed to be Sporothrix schenkii. Okay, because they gave a case also about it. All right, now. Histoplasma capsulatum is caused by what organism? Histoplasmosis is caused by what microorganism or what fungi? Histoplasma capsulatum. Histoplasmosis. The disease is histoplasmosis. Sporotrichosis, histoplasmosis. Okay, those are the diseases. Okay, if it ends with osis, automatically think about it as a disease. Now, histoplasmosis is typically seen inside macrophages in routine blood smears. The one that I showed you earlier. This is from the pathology discussion forum which is a Facebook group. Again, hindi tayo ma-demonetize yan siguro, Mark, no? Kasi nagbigay tayo ng thank you. Naka-data lang po, sir. Ayan na naman tayo, James Paul. Okay? Now, which animals or what animals may transmit histoplasmosis to humans? Sino dito yung mahilig mag-adventure? Yung tara guys, vlog tayo ganito. Punta tayo somewhere. Ganon. Who here? Raise your hand lang. We don't need to know where you went. Raise your hand if you like traveling. Because you might be at risk. We'll check. Deandra, okay, Deandra. Okay, who else? Walang gustong mag-travel. My God, ang saya-saya kaya mag-travel. Oh, si Amanda. Oh, since nag-raise ka ng kamay mo, Amanda, type on the chat where you've been. Di ba lahat ng tao gustong mag-travel? Amanda, where have you been? Somewhere not in Philippines. Hong Kong. Alright. Okay. Yes, taray talaga ni Amanda. Ang rich. Hoy, ang rich yan. Parang gusto ko magpalibre, Sir Marco, kay ano. Gusto ko kasi magpunta ng Japan. I just want to go to Harajuku. Diba? Ganon.
I mean, Japan is okay.
Oh, taray, taray talaga. Taray talaga niya. Nagaling na din siya doon. Nakakainis talaga siya. Ang yaman talaga ni Sir Marco niyo. Nakakainis. Alam mo yung minor flex si Sir Marco? Masyala po si Sir Marco. Alam niyo mas ano, alam mo yung minor flex si Sir Marco, hindi malatang nagyayabang si Sir Marco, pero nagyayabang siya. All right. So in those places, have you been into remote areas, Amanda? Yes or no lang? Yung remote places like yung kakahuyan, mapuno, magubat, mga ganon, or may kuweba, mga ganon. Wala ka namang pinuntahan. More or less in sea. Oh, near Mount Fuji. Very good. Very good because that's a good example. All right, near Mount Fuji, of course, there's going to be a lot of oh my gosh, Mark, parehas tayo ng kinakain, Mark. Oh my God, nakita ko lang. Mark, parehas tayo kinakain. Oh my gosh. Oh my God. Talagang ikaw talaga ang moderator ko. Anyway, let's continue. Near Mount Fuji, there's I'm assuming there's a lot of caves there where bats inhabit, right? So you might get it from sterling birds or bats, and basically how the fungi is transmitted to humans is inhalation of Histoplasma capsulatum spores in the feces of these animals. Okay, so somewhere there, humid sa Mount Fuji. Wait, let me see if there's cases of histoplasmosis in Japan. Yeah. Okay, so it's non-endemic in Japan, but cases of histoplasmosis occur in caves. Okay, all right. So yeah, so it's not endemic in Japan, but there is a case of pulmonary histoplasmosis way back in 2024. Oh, 24. Way back in 2014 pala. 24 tuloy. Nag-time travel ka, Sir Manuel. 2014. Okay, so see. So cases where in places where there's bats and there's caves, you might consider wearing masks. Okay, baka mamaya maka-inhale kayo ng spores. Okay? Because these are places where birds and bats take poop or do their business. Number two or number one. Okay? So be mindful of these things. Okay? Now, what types of tissues are usually infiltrated by Histoplasma capsulatum? It's your RES cells or reticuloendothelial cells or members or cells that are involved in the RES system or the RE system or reticuloendothelial system. And one thing that you need to take into consideration is that histoplasmosis mimics the clinical features of what disease? It mimics Mycobacterium tuberculosis or MTB. Okay, so you might see a case. Okay, you might see a case. Apical lordotic X-rays show infiltrates in the right lobe. Mga ganon. Patient has been suffering from cough. What else? Aside from cough, midnight sweats, okay? Yun yung mga symptomology kasi ng PTB. So baka mamaya kino-confuse lang kayo ng exam. So obviously you have to look at the whole history of the patient because Mycobacterium tuberculosis is not something that you would get from traveling to places where there's a lot of bats or caves in general, okay? So histoplasmosis is commonly acquired in caves. Now, let's go to blastomycosis, which is another thing that you need to take into consideration. Blastomycosis is caused by Blastomyces dermatitidis. It's in the yeast form. Its yeast form is characterized as a yeast compass or a thick-walled yeast cell with a single bud. Okay, this is from the American Journal of Medicine. This is what it looks like. Okay? Hindi tayo madidemonetize diyan, Mark, kasi meron tayong mga shoutout dun sa mga pinanggalingan natin. Okay? So, yeah. So, this is what it looks like. It's a yeast compass because it's one of the few organisms that have a thick-walled yeast cell that has a single bud. Okay? Now, what stain did we use here? I want to see if you guys still remember what we talked about earlier. What stain did we use here? Ako patay tayo. Kakasabi ko lang kanina. What stain did we use? Come on, guys. You have... Why? Hindi LCPB yan. Blue ba yan? Hoy, hoy, blue ba yung organism?
Not the background, guys. Not the background.
The cells! Guys, the cells! The yeast cells. Talaga, marka. Marka. Silver nitrate. Very good. Silver nitrate. Yeah, silver nitrate. Right? Since mukha siyang galing sa tissue, ano ang histological modification natin? Mukha siyang galing sa tissue. Ano? Patay tayo. Kalimutan na nila. O, babalikan natin para hindi nyo makalimutan. Kayo talaga. Kayo talaga, guys, ha? Asan na yun? Nawala na ako. Nawala na, Sir Marco. Ang layo. Alright, it's methenamine. Gamori methenamine silver. It's not just silver nitrate. It's gamori. If it's in the tissue, it's gamori methenamine silver. Huwag niyo kakalimutan yung GMS. Kayo talaga. Ikaw talaga, Mark, ha? Puro kakain ng kain kasi ng ano. Kalimutan mo na yung gamori methenamine. Kanina ko lang sinabi. Kanina eh. Kanina lang eh. Okay? Saan na tayo? Alright, so this is what it looks like, a yeast compass. Blastomyces dermatitis is transmitted to humans via what? Bigyan ko kayo ng choices. Ano ba tawag doon? Intradermal. Hindi, pangit yung term. Ano na lang, let's try to simplify it. Ingestion, inhalation, or skin penetration. Okay. Inhalation according to Deandra. Okay. What about the other people? Skin penetration according to Mark Segi. Okay. What about the other? We only have 2 students. Skin penetration according to Amanda. Eliza said inhalation also. Okay. Okay. We need 2 more para at least kahit papano I would consider it as a party. Okay? Kahit wala lang, huwag kayo mag-alala. Hindi namin kayo i-judge si Sir Marco. Hindi ako ang nag-judge pala. Si Sir
No,
Marco
I will
ang
definitely
nag-judge.
judge pag ako.
Alexis po. Alexis inhalation po.
Hindi ko tinatago yun na nang judge ako ng estudyante.
Oo. Hindi mo naman tinatago. Judgmental talaga tayo. Lalo na yung 30 basophils. Kakaloka talaga yung 30 basophils na yan. Alright, so yeah. So, blastomyces dermatitis is again transmitted to humans by inhalation of spores. Okay? Remember, huh? They are usually dimorphic, and majority of the time it can only be transmitted to humans via the mold form. Okay? Majority of the time. So airborne po, inhalation. I changed my mind. Huli na ang lahat, girl. Huli na ang lahat. Okay? The majority of the organisms that we're going to talk about is going to be acquired through inhalation, except for sporothic Schenke. Okay? Okay? Now, skin lesions of blastomyces dermatitis are often mistaken with what dermatologic condition or disease? It's squamous cell carcinoma or skin cancers. Okay? Squamous cell carcinoma. Okay? Now, what is the causative agent of coccidioidomycosis? It's Coccidioides immitis. It's the other term for the test. The other term for coccidioidomycosis is valley fever. Okay? And it's diagnosed by observing a particular fungal structure in the tissue. It's known as spirule. A spirule in clinical samples. Okay? A spirule. If you see spherules in your exams, you automatically select coccidioidomycosis. Medyo nangungongo na din ako. I'm sorry. Okay, so this is what it looks like in clinical samples. This is a histological samples, of course. And how is it transmitted to humans? Sige, ayan na naman tayo. One of the few organisms din siya. Ayan na naman tayo. Same choices. Inhalation, skin penetration, ingestion. Answers. I need answers, people. Type in your answers. Naglagay ako ng underline para makita ko kung saan kayo nagsasagot. Inhalation according to Deandra. Okay. Amanda said inhalation also. Okay. Nigel said inhalation. Alexis, James Paul said inhalation also. Okay, very good. Look at this one. This one is from the What? It's a it's a lung tissue sample. Or by the way, this is from the University of Texas. I forgot to give a shout out. 'Di ba baka makalimutan natin, Mark? Okay? So, this is through the inhalation of arthrospores from the soil. 'Di ba? From the soil naman siya. Okay? And Coccidioides immitis is a fungal infection that is common in what natural phenomenon? During earthquakes. Okay? Or natural disasters. There was a spike in the cases of coccidioidomycosis, and I think the largest earthquake ever observed in 1980 something, in the 1980s, if I'm not mistaken with my medical history. Sorry, historical medical events. There was a spike in coccidioidomycosis in those times. Okay? Now, there is another one. This is the causative agent of South American blastomycosis. The causative agent is Paracoccidioides brasiliensis. Para hindi nyo makalimutan, South American. Oh, South American siya. So, saan ba ang South America? Ay, saan ba ang Brazil? Sa South America, di ba? Di ba? Okay? The morphological characteristics of Paracoccidioides brasiliensis is what you call the mariner's wheel. Okay? If you want to be specific, it's a yeast cell with multiple buds arising from a single cell, resembling what you call a mariner's wheel or captain's wheel. Okay? What is a mariner's wheel ba? Yung yung ginaganon sa, I'm not sure if you guys were old enough to watch. Alam ko old na ako. If you watched Titanic, yung ginaganon niya, no? Yun. So siya 'yon. Okay? Or Pirates of the Caribbean para much more contemporary tayo. Diba? It looks like that. It looks like that. Okay? Again, photo credits from the BOC Image Bank. What is the BOC Image Bank? This is where you might see questions from the extracted from the ASCP exams. Okay, so they use this as an example for one of those questions. Now, let's talk about opportunistic mycoses. Okay, opportunistic mycosis. I think this is the last example, the last thing that we're going to discuss before we move on to virology. Opportunistic mycosis includes these organisms: Aspergillus, Candida, sorry, Cryptococcus neoformans, Pneumocystis giroveci, and Mucor and Rhizopus. Okay? Aspergillus species are monomorphic and can only exist as a mold. Okay, so in many cases, you would not hear a lot of Aspergillus cases in the Philippines because they love the cold. Okay, they love areas where humidity is okay, and humidity is okay and or sufficient, and it's not too hot. Okay, so in the Philippines, it's not very common. But if you are planning to take the exams to find a job abroad, you must know this because there are certain, not just because of the exams, but because of your health also. If you're planning to move to or migrate to the United States, aspergillosis is something that you need to take into consideration as well. All right, now medical what is the most important characteristics of the hyphal strands that you need to observe when you're looking for when you're looking for aspergillus? You need to see that it's septate, it's branching, and it has angular structures or angular septations. Right, what do you mean by angular, sir? Unlike the other ones that we discussed earlier, hindi natin pinag-uusapan yung angles ng hyphal branches nila because it's not really that important. But for aspergillus, I'll show you guys an example of what it looks like. Earlier, we have branches that looks like these, right? Like parang puno talaga siya. Ay, yun pala yung angular. Yung parang puno lang talaga siya. Ganyan yung angles ng mga ano. Okay? But for aspergillosis, it has like a 45-degree angle. Like lagi siyang may kink na ganun. Ay, 90 degrees pala yan. Lagi siyang may kink na pag ganun. Tapos, very distinct talaga yung pagiging angular niya. Kasi nga, yun yung isa sa mga uh, identifying characteristics niya. It has an angular branch. Okay? Now, what is the most important fungal element used to differentiate species of Aspergillus? It is actually the conidophores. You look at the conidophores, the fruiting bodies, to differentiate the species of Aspergillus. Okay? Some of the Aspergillus species of non-clinical importance, they might be confused with medically important ones. So we're going to talk about the species that are important to humans. It's the most common human pathogen also. So Aspergillus fumigatus is the most common human pathogen. Usually fumigating apparatuses in the house is usually where you would isolate this pathogen. We also have Aspergillus flavus, Aspergillus niger, Aspergillus terreus. Okay? Now, the invasiveness of aspergillosis or Aspergillus as a group of organisms is based on the host's neutrophils. If the patient's neutrophil count is low, that is something that Aspergillus would love. If the patient has chronic granulomatous disease, they would have an impaired function of the neutrophils. Hence, they would love this person. They would love to infect this person. Okay, so just take note. It's actually the neutrophils that that depends that is there is a correlation between the neutrophils and the invasiveness of Aspergillus. If it's weak, or the number is or if it's functionally or quantitatively and quantitatively diminished, more often than not, you might get infected by the disease by Aspergillus. Okay, now, true or false? Aspergillus is rarely seen in patients with HIV. Aspergillus is rarely seen in patients with HIV. Oh, that is a question that I am going to ask the group. I'm going to start the timer. Everybody is expected to answer. Sir Marco, pag hindi sumagot, ano ang punishment? Kailangan malaman natin kung sino yung mga ano.
Chance number.
Ha?
Chance number bago mag-exam.
Dance number bago mag-exam. Otherwise, we will not accept the paper.
Oo.
Okay. Alright. So, everybody is expected to answer according to your professor. I am expecting at least 30 people to answer this one. If not, you're not listening or you do not want to participate. So, true or false? Aspergillus is rarely seen in patients with HIV. Sabi ni Amanda, true. Imagine ko yung boses ni Amanda, ang arte. True. Bibilangin ba natin, Sir Marco, mamaya? Bilangin natin, Sir Marco, no? Pag hindi umabot ng 30, merong ano. Diba?
I think 29 lang dapat kasi
29. Ay, dalawa
your
pala yung
presentation.
Oo.
Including the presentation, na tayong dalawa, so there are only 28 people here.
Bakit ang onti lang nang sumagot? And this is not enough. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. 19 lang. Ano yan? Nasaan na yung remaining? pag hindi, bahala kayo, tatayman ni Sir Marco. Titignan ni Sir Marco yan. Pag hindi na nakita yung pangalan nyo dyan, bahala kayo. Sasayaw kayo. Alright, so everybody is it's a unanimous decision. It's a unanimous
Segi, paki-take note lahat ng sumagot.
Lagot ka, Segi.
Noted, sir.
As of this moment, may +2 kayo sa MYV.
Oh, di ba? Lalagyan ko na ng underline para hindi na pwede magdagdag. Ayan. Ayan, so 10:37, after 10:37 wala na kayong +2. Di ba? Di ba ganyan kami ni Sir Marco nang bibigla na lang na mayroong points. Ganon. Kala nyo yung kala nyo sinacharot lang kayo Sir Marco, walang kinalaman yung exam, no? Di ba? Surprise! O, di ba? Amanda, oh. Nabigla din si Amanda. O, di ba? Now, let me explain why. It's the correct answer is true. Even in patients with extremely CD4, HIV is not all HIV patients suffers from impaired or low counts of neutrophils. So, sabi ko nga kanina, CD4 lang naman yung ano. CD4 lang naman ang may problema sa HIV and AIDS patients, right? But our main concern is the neutrophils. Okay, if a patient has neutropenia or CGD or impaired neutrophil function, then that's the reason that you might get a problem with Aspergillus. Not true. It's actually true. Sorry, it's actually true. Okay, it's actually true. Rarely seen. Okay, so be mindful of that one. Now let's talk about ABPA. ABPA is also known as allergic bronchopulmonary aspergillosis. Okay, aspergillosis, bronchopulmonary aspergillosis. It is an allergic form of aspergillosis, which is quite rare. You will have an increase of IgE in these cases. So this is again a question that might be asked not in your microbiology, but in your but maybe in your immunology and serology questions, okay, or in your exams in serology. Now, this is a fungus ball formed in the lung cavity of patients with aspergillosis. This is known as aspergilloma. Actually, if you look at it in the X-ray, if you Google it now, aspergilloma X-ray or radiology, you would see that it's similar to a lung cancer opacity, similar to that one. The reason being is because of the contents of the said fungal ball. But upon biopsy, that's the time we get to confirm it because you get to see a lot of conidophores. Okay? Now, fungal antigens can be used as what type of diagnostic tool in patients suspected of aspergillosis? You can use it is an indirect diagnostic tool because you are only testing can be used. You're only testing the antigens against antibodies. Okay? So it's not really a specific one. It's more or less an indirect tool because you are testing if the patient was exposed to aspergillus. It's not really direct because you're not testing the organism per se. You are testing the effects of what happens when a person is exposed to aspergillosis or an aspergillus organ or the fungus itself. Okay? Now, what fungal antigens may be used in the indirect detection of aspergillus? You can use galactomannan and beta-D-glucan. Glucan. Naano ko sa galactomannan. Galactomannan and beta-D-glucan. These are the two antigens that may be used for the indirect antigen testing or indirect testing, serological testing of aspergillus. Now, what samples may be used to detect fungal antigens of aspergillus? Obviously, you need to use blood, of course, or you can use BAL. What is BAL? Yan ba yung kaibigan kong si BAL? BAL. Magtawag tayo dun sa mga sumagot kasi ibig sabihin sila nakikinig eh. Tawagin natin si Marivic Sastre. Marivic, what is BAL? Patay tayo dyan pag hindi ka nakasag. I-judge talaga dahil yan. Marivic Sastre, what is BAL? Yan ba yung kaibigan kong si BAL? Marivic, are you there?
Maribig!
Ayun na, tumutulong na si Amanda. Patay tayo dyan, Marivic ha. Marivic, may plus 2 ka. Bukas nabawiin ni Sir Marco yung plus 2 mo. Amanda. Okay, Amanda. What is BAL? Ay, ano yon?
Bronchoalveolar lavage po.
Oh, diba? Ayun. Very good. Bronchoalveolar lavage. Thank you so much. All right. Now, which species of aspergillus is capable of producing toxins? Okay, this is known as this species specifically known as Aspergillus flavus, and the toxin is aflatoxin. Okay, Aspergillus flavus and aflatoxin. So please don't forget that one. What illness is caused by aflatoxins? It's aflatotoxicosis. No, it's not. It's different from aspergillosis. Okay, aspergillosis more of the ones that we discussed earlier. Aflatotoxicosis is the toxins produced by a specific Aspergillus species, specifically the one that produce aflatoxin, okay, which is Aspergillus flavus. Okay, clear? Clear. So there's two types of diseases that you might get from an Aspergillus organism. Okay, so we discussed those two already. Okay. Now, organ that may be affected by aflatoxins is, of course, your liver. Hence, the reason why it is important that we diagnose it immediately, because chronic exposure to this substance can cause liver cancer. It is considered as a what? As a cancerous substance, or a cancerous toxin, carcinogenic to be exact. All right. Now, how can humans acquire aflatoxins? Sir, anong kaguluhan? How can humans acquire aflatoxins? O, ito na naman tayo. Magtatanong ako ng mode of transmission. Mode of transmission of aflatoxins. Aflatoxins. Inhalation, skin penetration, or ingestion. O, ayan na. Ayan, oh my God. Oh my God, may sumasagot. Pero tingnan natin kung tama. Siyempre, Mark Sego, tingnan natin kung tama. O, diba? Sino pa? Dalawa lang, Glenn. Okay, Glenn said, okay, James Paul said dito, kay James Paul, bida ang sarap. Diba? Ganon. Okay, who else? Nasaan na si Nigel? Nigel, kanina pa yung tinitingnan. Ayan na pala. Okay, so everybody said ingestion. Mali pala. Char. Hindi. Ingestion. Correct. O, ika nga ni Chris Aquino. Correct! Diba? Ganon. Alright, now, ingestion of animal products that have previously been, this is basically to the ingestion of animal products, could be milk, okay, that have been contaminated with the toxin, or infected peanuts or rice or maize. Okay, peanuts, rice, or maize, sir? Ano yung maize? Ano yung maize? Yung ano lang siya, yung parang, I don't know if you guys have eaten maize, but how would you describe maize, Sir Marco?
I do believe it is pronounced maize.
Mais. Nakakainis.
No. No, kasi it's corn.
Parang gusto ko sabihin binatog, pero sige na nga mais. Sige na mais. Mexican kasi daw, sabi ni Amanda. Diba? Social, si Amanda lagi nakakasabay sa kasosyalan ni Sir Marco. Diba? Tayong lahat dito, we are all peasants. Diba? Ganon. We are all peasants studying medical microbiology. Alright, now, let's talk about cryptococcosis. Okay, wait. Hang on a sec.
Pinabomba na naman ata sila Manuel.
Forcing them to contribute.
Sorry. Nasunog yung niluluto ko. Hindi ko pala na-off. Diba? Diba? Ganon talaga, diba? Kakapag-usap natin ng mais. Nakalimutan ko. Kaya pala nag-alarm kanina. Anyway, buti na lang ginising ako ng housemate ko. Buti na lang. My God, sayang yung itlog. Oh well. Anyway, let's move on. May mga ganun talagang pangyayari sa buhay, unavoidable. Because maganda ang discussion. Ibig sabihin lang yan, maganda ang discussion at saka active ang mga students. Okay? Diba? Safety ko, Sir Marco, ang apektado dito sa lecture na to. Naku, Diyos ko, Sir Marco. My goodness, nasunog na sana ang bahay namin. Alright. Now, let's talk about cryptococcosis. Now, the causative agent of cryptococcosis is Cryptococcus neoformans. Okay? Cryptococcosis is caused by Cryptococcus neoformans. The organ system that is affected is the CNS. And it causes the cryptococcal meningitis or fungal meningitis. It's one of the few. It is the one that is specifically related to fungal meningitis. Although in some cases where the patient is immunocompromised, okay, There are some there are some fungi that can cause cryptococcosis, but in this case, it is the one that is directly linked to the CNS. Okay, specifically linked to the CNS. So if a lot of the cases, you will not be asked this question. The other ones can have CNS relationships also, but for exam purposes, remember that Cryptococcus neoformans, CN already, CNS. O ayan na Amanda ha, tinulungan na kita ulit. Baka mamaya makalimutan mo na naman Amanda. Okay? Clear tayo dyan Amanda. Okay? CNS, okay? Cryptococcus neoformans, CNS, central nervous system, okay? Clear? Clear. All right. Now, Cryptococcus neoformans is a monomorphic fungi that only exists as a yeast, okay? It only exists as a yeast in nature, right? So it's a monomorphic fungi. And the most important virulence factor of Cryptococcus neoformans, as with any CNS related organism that we have discussed so far, is what? Baka makamaya may nakalimot na naman. Ano, kanina yun yung hindi na i-stain, kaya nga background eh, 'di ba? Nako. Most important virulence factor is sa stira din nag-i-start. O, ayan na. Binigay. Capsule daw according to Deandra. Tingnan natin kung tama si Deandra. Deandra, tama daw. Chosen one ka talaga, Deandra. Capsule. Very good. It's the capsule. It allows the organism to evade phagocytosis. It not necessarily evade, but survive phagocytosis. It's capable of antigen switching. That's the reason why the terminology that we use is phagocytic evasion. Kasi nga, the capsule is so malleable in terms we call it biochemical malleability that the antigens of this particular organism or the capsules of this particular organism switches whilst inside the human body. Okay, so be careful with Cryptococcus neoformans. Now, what staining technique may be useful in the diagnosis of cryptococcosis? It is India ink or nigrosine stain. Okay, India ink or nigrosine prep. Oval yeast surrounded by a clear halo. Okay, we've already talked about that earlier. We don't need to delve deep into that one. Now we want to stain it. If we want to stain it, or particularly the presence of the capsule of this particular organism, we are going to use mucicarmine stain. Mucicarmine is one of those stains that targets specifically the carbohydrate portion of a particular cellular structure. It stains the capsule red. Mucicarmine. Okay? Mucicarmine. Now, the appearance of Cryptococcus neoformans in gram stains is, when a CSF sample is used, is that it appears like a starburst. This is what a starburst looks like. And photo credits to pathologyoutlines.com for giving us this particular photo. Mark, di tayo madidemonetize, no? Lagi mo sabihin sa akin kapag hindi ako nag-thank you dun sa mga pictures, okay? Now, which population of immunocompromised individuals are at risk of cryptococcosis? Obviously, HIV/AIDS patients. Okay? HIV/AIDS patient. Majority of the time, in your case presentations, you would see a lot of immunocompromised patients. But for cryptococcosis, the immunocompromised population that we're looking for, or that is usually affected, is HIV/AIDS patients. Now, this is a monomorphic yeast that is the most common cause of genital or oral infections. O, ayan na, girls. I think girls will know the answer to this one. Okay? Pag hindi nyo alam, patay tayo dyan. Answers on the chat box. Answers on the chat box. Kasi, i-judge kayo ni Sir Marco pagka hindi nyo nasagot yan. Okay? Baka mamaya yan, si Arnie pa, at saka si Mark ang makasagot, at saka si James Paul. O kaya si Roy. Oh, talaga si Amanda, active na active ngayon. O sige, si Amanda is correct. Alright, Amanda is correct. Okay, Candida albicans. Now, at room temperature, the appearance of Candida albicans is that it appears as a single-celled yeast. But at body temperature, it produces a particular, a specific appearance known as a pseudohyphae, or a yeast with a pseudohyphae known as germ tube. It's not really a hyphae, but more so just an extension of the single-celled yeast. Okay, hence the term germ tube. Okay, germ tube. Now, the easiest way to detect germ tube is to identify candidiasis is through culture and of course germ tube demonstration using human and sheep serum. Candida albicans thrives in high sugar environments. Therefore, patients with this condition are at risk for developing candidiasis. High sugar level environments. Sino lang ba ang mga cases natin na pinag-aralan natin in clinical chemistry? Oh, 'di ba? Sumagot kagad si Diandra. Galing-galing talaga. Natutuwa ako ngayon. Active talaga kaya nasunog yung niluluto ko eh. Kaya nasunog yung nilalaga ko eh. Active. Kasi maganda ang discussion. Kapag ka may energy ang audience, ibig sabihin, may energy din si lecturer. Now, this is a protozoan that is now classified as a yeast. Not sure if they're going to ask this in their exams, but maybe Sir Marco may nominate you to be a contender in the PAMIT quiz show. So, who knows the answer? This is usually a protozoan. I would have discussed this yesterday, but had it not been reclassified in
Yeah, this is relatively new.
Tinanong siya nun sa mga kinoach ko na sino bang taga MCU dito? May mga kinoach ako taga MCU eh. Isa yan dun sa mga tinanong sa exams nila. Buti na lang na-discuss ko sa kanila yon. Nasagot nila yung question na yan. Wala makasagot? Siret na? May prize ako niyan. Sayang. Pneumocystis girovecii. Talagang si Diandra talaga. Okay, sige. Diandra, you know the drill. Send me again your GCash.
What's the other name?
Ayan, ako patay tayo. Nakakaloka ka, Sir Marco. Yun lang naman yung Pero may other name siya. Sa PAMIT quiz show kasi may yung other name ang tinatanong. Sige nga. Other name. Dadagdagan natin ng another 100. Hindi ka kasali, Mark. Nakakainis ka, Mark. Dami-dami mo nang ang plus eh. Panira naman to si Mark panira naman to si Mark ng trip, oh. Madami ka ng plus. Hindi ba sabi ko sa'yo, immune ka na. Pero yeah, what Mark said is correct. Pneumocystis carini. Right. Very good.
Kasi board exam question to, if I remember. Tinanong nila yung new name.
Pero sa akin, hindi ko siya nung time ko ha. Hindi ko siya na-experience. Pero siguro ngayon, tinatanong na nila. 'Di ba? Tagal na akong wala sa Pilipinas eh. Pero yeah. So, before it was a protozoan, if you look at the old books for parasitology, what books did they use, Sir Marco, for parasitology? Ano ba yung mga references na binibigay niyo diyan? Yung Baylis and Scott's pa rin, medical. Baylis and Scott's. Oh, yun. Baylis and Scott's pa din kaya So, if you bought the old version, the one that I think it's the white one. If you bought the white one, no, the white one is the recent one. The maroon one, it still classifies it as a protozoan. Okay? So, yun lang yung notable thing to remember about this one. Okay? Now, the stain used to demonstrate clinical samples from AIDS patient with Pneumocystis girovecii is of course methenamine silver nitrate. Okay, methenamine silver nitrate, and the appearance of the yeast is of course they have the appearance of saucer cups. Ano ba yung saucer cups na yan? Ayan yun. Okay, now credits to Picmonic because they're the ones who gave it to us. Left side is methenamine silver, specifically Gamori methenamine silver. Right side is modified acid fast staining. Okay, modified acid fast staining. You can stain it with modified acid fast. Okay? Lactophenol cotton blue pala, modified acid fast. Okay? Now, correction for the record. This is not modified acid fast. This is lactophenol cotton blue. Okay? So, they appear as saucer cups. So, parang saucer cups nga sila, diba? Diba? Parang saucer cups nga siya. Credits to Picmonic. Okay? Now, let's talk about the last organisms that we're going to talk about in today's lecture. About viruses. About fungi. These are the causative agents of mucormycosis. These are the organisms in question is of course Rhizopus and Mucor. All right, Rhizopus and Mucor, and the clinical conditions that may be at risk or clinical conditions that may be at risk for developing mucormycosis is diabetic ketoacidosis. Why? Why specifically patients with DKA? Because they thrive in ketone-rich environments. Okay? They thrive in ketone-rich environments. So, kanina, si Candida, diabetic lang kasi high sugar environment. So, causative agents of mucormycosis, they love ketone-rich environments and they thrive in this particular in this particular cases. Okay? Now, opportunistic fungi, often mistaken for mucor or rhizopus, is aspergillus because of the fact that they also have angular septations in their hyphal structure. But for Mucor and Rhizopus, the difference is that it has a 90-degree angle. Kaya nga kanina kinorek ko yung sarili ko, di ba? Hindi dapat 90-degree, 45-degree angle lang. Pwede ba nating ma-measure yon? Yes, pwede nating ma-measure. Nakita nyo yung, not sure if the microscopes that you have there in CMMC, they have that red line there. Sorry, not red line. Ano nga yun? Yung black line pala na parang pointer.
Yung pointer po.
Yun.
Yung iba
So,
po.
so pag nag-match doon yung hyphal strand in a straight line, that is considered as a 90-degree angle. Tinuro lang sa akin yun na nagpunta ako dito sa ibang bansa. Hindi ko din alam na pwede mo palang gamitin yun to measure the angle specifically for 90 degrees. Okay? So yun. Isa yun sa mga tinuro sa akin. So Manuel, sabi sa akin, man, all right, ya manual, ganun yung accent ng ano ko, ya manual, this is how you measure the angle of the hyphal strands, ganun kasi Egyptian yung nagturo sa akin sa hyphal strands daw. All right, ya manual, hindi Manuel ang tawag sa akin, manual, as in love manual. Okay? Ganun. So you can use that as a reference for measuring 90 degrees. Okay? Now, common black bread mole is caused by rhizopus. So please don't confuse this with the pathologic rhizopus. Okay, so black bread mold is caused by rhizopus stolonifera. Okay, stolonifera. Now, because I want you guys to be well informed about rhizopus species, about mycology. We have a case study at the end, and this is the case study that we're going to do. Okay, BAL was taken from an AIDS patient. Routine microbial stains noted that the patient has gram-positive branching and septated hyphae with angular branching. What organisms may be considered in the diagnosis? What other tests should be done? Okay? Diba? Meron pang isa. Okay? Meron pang isa. A traveling vlogger came to the ER with complaints of cough, night sweats, and difficulty of breathing. Prior to the onset of symptoms, the patient went out in the wilderness following a migratory pattern of fruit bats. A week later, the symptoms began to appear. Blood work was done and leukocytosis and slight anemia was noted. Blood smear shows fungal infiltrates in neutrophils. What is the most likely organism? Let's go with case number 1 first. Bronchoalveolar lavage was taken from an AIDS patient with routine microbial stains noted in the gram stain indicating gram-positive branching and septated hyphae with angular branching. What organisms may be used for the diagnosis, may be considered for the diagnosis? Ayan. Sagutin muna natin yan. Kasi ganyan ang mga tanungan na mga ibibigay ko sa inyo. Gram-positive, septated hyphae with angular branching. Ano muna yung organism? What organism may be considered? So I'm asking 2 types of organisms. Diba? Diba? With angular branching pa. Sino yun yung may 90 degrees tsaka 40 degree? Ayan na. Hindi ko na pa ipahirapan. Dalawa lang naman yon. Rhizopus and aspergillus. Very good. Now, how do we differentiate rhizopus from aspergillus? What test can be used? Dapat ano yan, ha? Dapat hindi ko nga tinuturo sa inyo to kasi parang madali na lang ang exam ninyo kapag tinuruan ko na kayo ng ng case presentations. 'Di ba, Sir Marco, no?
Yes, sir. Dapat sanay na silang maghanap ng kung alin lang yung clue.
Oo. Hindi ko nga dapat tinuturo sa kanila kasi parang given na yung sagot kapag nasagot nila 'yon. What other test should be done? O, babalikan natin, class. Gusto niyo balikan natin? Punta muna tayo kay Rhizopus. 90-degree angle. Ay, Aspergillus tayo. Balikan natin si Aspergillus para hindi kayo malito. Gagamit tayo ng fungal antigen tests. Testing for beta-D-glucan or galactomannan. Diba? That's one test. Or you can stain or you can do allergic bronchopulmonary aspergillosis testing, IgE. Diba? IgE ang mini-measure natin. Or you could check the neutrophils. Diba? You can check the neutrophils. Neutrophil count or neutrophilic function. TGD testing. Diba? Diba? Madali lang. Diba? Madali. Siyempre, pahirapan ko kayo sa exam niyan. Hindi lang naman ganyan ang tanong ko. Napakadali naman nun kung ganun ang sagot lang, no? Balik na tayo kay number 2. Feeling ko lahat yan masasagot na ninyo. Ay, nawala yung ano ko. Napasobra. Okay? Now, traveling vlogger came to the ER with complaints of cough, night sweats, and difficulty of breathing. Sandali lang, sir. Akala ko ba microbiology ang mycology ang pinag-aaralan natin? Bakit parang TB to? Uy, ano yun? Anong sakit yun pag it resembles TB? Di ba? Ayan na. Meron na yung ulit clue. Di ba? Prior to that, the patient went to the wilderness following the migratory patterns of fruit bats. A week later, symptoms began to appear, and blood work was done. Blood work was done, and leukocytosis and slight anemia was noted. Blood smear shows fungal infiltrates in neutrophils. What is the most likely organism? Anong sagot natin dyan? Histoplasma. Kulang. Patay tayo dyan. Kulang na naman. Histoplasma ano? Histoplasma capsulatum. Okay? So very good. Okay? So all the lectures will be available to you in this particular website. Please don't forget to like, share, and subscribe. Ganun pa etchos. May mga ganung etchos pa, Sir Manuel. Ano bang kaartihan yan? Okay. So, I'm going to end the lecture for mycology in this one. We're just going to stop the stream para may separation yung mga ninyo, mga lectures ninyo sa